Hi there, I'm Dr. Brigid Norton. You can call me Brigid. This is Menopause Bytes, where I unravel the mysteries of menopause for you in bite-sized episodes. Today, let's dive into hereditary cancer genes and the benefits of hormones. What does that mean? Well, this is for those of you who might carry a hereditary cancer gene like BRCA1 or BRCA2, or have a genetic condition like Lynch syndrome. These genes and syndromes can significantly increase your risk of certain cancers, including breast, ovarian, uterine, and colorectal cancer. If you have a BRCA1 or 2 gene mutation, your lifetime risk of developing cancers like breast or ovarian cancer go up significantly. The exact risk differs depending on which gene you actually have, but in both cases, and with some of the genetic syndromes, doctors typically recommend risk-reducing surgery by a certain age. Now, what exactly is risk-reducing surgery? This is surgery that removes that body part that could develop cancer. For BRCA carriers, this usually means removing both breasts, called a bilateral mastectomy, between the ages of 35 and 40, depending on your family history. It also involves removing your fallopian tubes and your ovaries. If you have BRCA1 or Lynch syndrome, it is generally recommended that you have this surgery by age 35 to 40, or when you're done having babies. For BRCA2, the timing is a little later, around age 40 to 45 for that surgery. Taking this step not only reduces your risk of ovarian cancer, but it reduces your risk of breast cancer too. It's surprising to learn that only 50 to 74% of women will actually undergo risk-reducing surgery to prevent ovarian cancer, and less than 20% will do this by the recommended age. This leaves many women at risk for developing ovarian cancer, a hard-to-detect and life-threatening disease. If you are at high risk for breast cancer, there is reliable screening using mammograms and MRIs. However, there is currently no effective screening tool for ovarian cancer. That's where hormones can make a difference. Did you know that birth control options that contain both estrogen and progesterone, like the pill, the patch, and the ring, can lower your risk of ovarian cancer by 30 to 50%? They also reduce your risk of uterine cancer by 34% and colorectal cancer by up to 20%. So, if you have an increased risk of ovarian cancer, you should seriously consider taking this type of birth control until you've had your risk-reducing surgery. Unless, of course, you're trying to get pregnant or you can't actually take this type of birth control. These estrogen and progesterone-containing birth control options come with other health perks too. They can improve acne, stabilize your mood, prevent ovarian cysts, help with endometriosis and painful periods. What about breast cancer risk with these types of birth control options? Studies show no increased risk in women with hereditary cancer genes using estrogen and progesterone-based birth control. In the general population, the risk is very low, about 1 additional case of breast cancer for every 7,690 women per year. But as we said, we have reliable screening methods to detect breast cancer. So the risk, if there is one, is both minimal and manageable with screening. It might seem surprising that some women delay a surgery that lowers their risk of ovarian cancer, but it makes sense when you consider the impact of early menopause. Early or premature menopause increases your risk of osteoporosis, heart disease, dementia, and depression. Plus, it can bring on abrupt and disruptive menopausal symptoms like hot flashes and night sweats, vaginal dryness, sleep issues, to name just a few. And it can also cause emotional turmoil related to the loss of your breasts and ovaries. The good news, menopausal hormone replacement therapy can help reduce those long-term health risks and treat those menopausal symptoms, which will improve your day-to-day quality of life. Even if you feel fine and aren't having menopausal symptoms after your surgery, hormone replacement therapy is generally recommended until the age of 51-2, and then it's reassessed on an ongoing basis. For early menopause, higher doses of hormone replacement therapy are generally needed. This usually means starting with the 0.1 milligram estradiol patch or equivalent, paired with 200 milligrams of nightly progesterone if you have a uterus, and then adjusting as needed. Hormone levels might also be monitored to ensure optimal replacement. If hormone replacement therapy isn't an option for you due to cancers or other health conditions, non-hormonal treatment options can help manage your symptoms. Check out my episodes on induced menopause and non-hormonal options to treat menopausal symptoms to learn more. Surgical menopause can have a profound impact on your overall health and quality of life. Seeking medical guidance promptly allows you to address symptoms and reduce those long-term health risks. Even if you're not having any issues after your surgery, discussing preventive measures like hormone replacement therapy or non-hormonal options with your healthcare provider is essential. So that's it for another episode of Menopause Bytes. Here are some take-home bites to remember. Women who carry a hereditary cancer gene are recommended to get risk-reducing surgery by a specific age, and that might include removal of both breasts, fallopian tubes, and ovaries. To minimize your risk of ovarian cancer, you should consider estrogen-containing birth control options like the pill, the patch, and the ring until you get your risk-reducing surgery. And then once you have your risk-reducing surgery and are in surgical menopause, you should take hormone replacement therapy until at least the age of 51 to 52 to treat menopausal symptoms, but also to reduce your lifetime risk of heart disease, osteoporosis, dementia, and depression. Until next time, may your hot flashes be bearable, your nights restful, and may your mood swings swing in your favor.